everyone. Happy morning. A very good morning. I hope and I believe all of you are doing well. A quick note whether the audio visual is all good. All right. So today it is 19th of May and day after tomorrow. Basically, it's the D-Day, and I hope all of you are doing well. Please do not get stressed. All right. If you have not watched the yesterday's video, please watch that. That how to stay calm and cool in these last days. Just detach yourself from the results, from the expectations, and you will see that sudden shift in your mind becoming calm. That's if you can practice that one thing, not expecting anything from the results, I think then you can go to the exam very much relaxed. And if you go relaxed to the examination hall, I am pretty sure that that's going to give you extra marks. That's very, very important. Remember, in the examination hall, it is basically the attitude, as I always say, which is more important than the aptitude. Now, someone who has a very, very high aptitude, who has read everything, imagine all the 19 subjects, has been a topper throughout, but suddenly, cannot maintain the calm and gets a panic attack in the exam hall, you know that nothing matters, right? It's finally the attitude which matters in the examination hall. The entire year, it's the aptitude, but in the examination hall, it's the attitude. And yes, remember everyone, okay, my best wishes are always with you, and I would be waiting to hear from each one of you after the exam, right? Okay, so today we'll kind of quickly discuss psychopharmacology, whatever is the important thing. Let's just start discussing that. So this is one important table that we can quickly discuss. So in ADHD, what are the preferred drugs? So we use stimulants like methylphenidate and amphetamines. So remember, in ADHD, it is methylphenidate. Okay, it is methylphenidate. Alcohol withdrawal, basically to calm down the patient, we use benzodiazepines, right? So delirium tremens, vagera, it is benzodiazepines. Bipolar disorder, it is lithium. Valproate is also a very important drug in bipolar disorder. And you have lamotrigine, which can also help in bipolar disorder. Okay. Bulimia, now majority of the conditions in basically in psychiatry, a lot of conditions you'll see SSRIs being used, like bulimia nervosa, depression SSRI, generalized anxiety disorder SSRI, OCD we have SSRIs, right? A majority of the conditions you would see SSRIs, panic disorder, PTSD. At many places it is SSRIs which are used, including the social anxiety disorder. For schizophrenia, basically which is psychosis, we use atypical antipsychotics. Atypical antipsychotics which will have less side effects as compared to typical. Even for Tourette syndrome, it is antipsychotics and we have tetrabenazine. Now, when a person has performance anxiety, for that the preferred drug is beta blockers. Okay, for performance anxiety, it is beta blockers that are used. Okay, so this is so basically in psychiatry. Remember कि काफी सारा जगह पे it is SSRIs that are used. Lithium is used in bipolar disorder, atypical antipsychotic schizophrenia, and alcohol withdrawal, it is benzodiazepines. For ADHD, it is methylphenidate, which is used for ADHD, methylphenidate. And for narcolepsy, what drug do we use for narcolepsy? Modafinil is an important drug that you should remember. Remember, modafinil is basically your mood alert. Okay, it is a mood alert that is it alerts. It makes a patient alert. In narcolepsy, we have history of sleep attacks daytime. So to make the patient alert, we have moda alert, mood alert. That is modafinil. Okay, that is modafinil which is used. Now, next one in psychotherapy, most important to me, what psychotherapy is used for borderline personality disorder? Is it the cognitive behavioral therapy, dialectical? What is used for borderline? See, for borderline personality disorder, remember this important point. We have dialectical, which is used in borderline personality disorder. Very, very important. Okay, very, very important. Borderline personality is your dialectical behavioral therapy. Okay. For phobia, we use behavioral therapy. So basically, behavioral therapy, it teaches patients how to identify and change the maladaptive behavior or reaction to stimulus. So desensitization is done in phobia, right? We expose the person to that particular phobic situation with all the cautions and we try to desensitize. That is behavioral therapy. What is cognitive behavioral therapy? Cognition means thought. We have seen the disorders of thought. It teaches patients to recognize the distortion in their thought process. Okay, that is your cognitive. Interpersonal means interpersonal. It works on improving the relationships and communication skill, and we have supportive therapy. So very important here to remember that in borderline personality disorder, we use dialectical behavioral therapy. All right. Now, the next that we have, what are the drugs, important drugs used in Alzheimer's? Alzheimer's is basically decreased acetylcholine. Remember the neurotransmitter. From where this acetylcholine comes, which nucleus? It is basalis nucleus. Remember A and B. It's the basalis nucleus of Maynard. So we try to increase the acetylcholine by giving acetylcholine esterase inhibitors like donepezil, rivastigmine, galantamine. All of these are acetylcholine esterase inhibitors, right? So these are centrally acting. They cross the blood-brain barrier. Now, which is the NMDA antagonist? Okay, remember memantine. MMN, that is M and N, that is NMDA. Which is the NMDA antagonist? It is memantine, which is used in Alzheimer's. Then we have fasudil. Fasudil we have read in angina also. It's your Rho kinase inhibitor, right? The flow, Rho matlab the flow. That is fasudil. Then you have something called as PDE1 esterase, PDE1 inhibitor. That is vinpocetin. Okay, remember, Vin is like 1. Okay, Vin is like 1. So it is your 1 inhibitor. PDE1 inhibitor, that is vinpocetin. Okay, that is vinpocetin. The new drugs that are being researched on immunotherapy against beta amyloid, which accumulates in Alzheimer's. So remember BA, bapineuzumab. Remember, mu matlab neurological. It is used for some neurological disorder. BA is your beta amyloid. So remember, this is used for Alzheimer's. Solanezumab, again NE. Crenezumab, again NE. So remember, solanezumab and crenezumab are also for Alzheimer's. Okay, they are also for Alzheimer's. So basically, remember BSc, right? BSc degree या BCS, कुछ भी याद कर सकते हो. That is your monoclonal antibodies used in Alzheimer's. All of them will have NE or new in their spelling. Bapineuzumab is beta amyloid. Gamma secretase inhibitor. Okay, so gamma, GAMA, Simaga C stat. Remember, this is gamma and this is secretase inhibitor. Okay, stat matlab inhibitor. So Simaga C stat, that is gamma secretase inhibitor. This is also used in Alzheimer's, and we have beta secretase inhibitors. So some of the new names, like we saw, vinpocetin, Vin is 1, PDE1 inhibitor. The monoclonal antibodies used in Alzheimer's, bapineuzumab, solanezumab, and crenezumab. And we have Simaga C stat, that is your gamma secretase inhibitor. Okay, gamma secretase inhibitor. And yes, you have the rest of the drugs. Memantine is NMDA antagonist. Okay, remember, memantine is NMDA antagonist. Never read this before. It's absolutely fine. These are some new drugs. So just that one day before the exam is when is the right time to read this. So Nishu, if you have not read this before, it's absolutely fine. Okay, now coming to the drugs for psychosis and bipolar disorders. So see, in bipolar is when we have the lithium, which is a classic drug to be used. Apart from that, valproic acid has an important role. Antipsychotics, How do antipsychotics act? Basically by inhibiting the dopamine. Remember, psychosis is increased dopamine. So we give anti-dopamine drugs. Classic one, they are high blockers of D2. Newer agents, less D2, but they act on other receptors, right? They act on other receptors. So clozapine, olanzapine, quetiapine, all of these are the drugs which are used in psychosis. All right. Now let's have a look at this. If I ask you that for which antipsychotic drug do we need CBC monitoring? Weekly CBC monitoring is very, very important for which antipsychotic? This you will, it's okay. Even if you don't read this, I've just told you this well for it. Okay. Which antipsychotic drug needs CBC monitoring? Remember, that is clozapine. Never to be forgotten side effects of clozapine. CLO is counts low. So basically it affects the WBC count, agranulocytosis. LOZ is your low seizure threshold. It causes low seizure threshold. ZAP is your ZAP. That is ZAP karke the weight increases. Then we have Pinewala, that is siloria, the wet pillow syndrome, right? The wet pillow syndrome. Which antipsychotic causes QT prolongation? Which antipsychotic causes QT prolongation? QTZ. Alphabetically, when you write QTZ, so remember your QT prolongation, thioradazine is important. Then we also have ziprasidone. Okay, ziprasidone is also important. Okay, ziprasidone is also important. Which antipsychotic causes weight loss? Weight loss is seen with, remember, ZAP is ZAP karke increase. ZIP is basically the dip in the weight. So ziprasidone is the one which causes weight loss. Okay, ziprasidone causes weight loss. Which is the one which has D2 agonism also, partial agonist? Antipsychotics are D2 antagonists, but there is this one drug which has this agonist activity also. That's a surprising feature, that is array. When we see anything surprising, we say array. Remember array, that is aripiprazole. Okay, very, very important, aripiprazole. So the clinical application, whenever the D2 is blocked, it leads to hyperprolactinemia. So if a patient on antipsychotics is experiencing hyperprolactinemia, galactorrhea, so we can replace it with aripiprazole because it is a D2 partial agonist also. Okay. Which is the one which causes cataract? Cataract is caused by, read it as quatract. Cataract is like quatract, that is quetiapine. Okay, quetiapine causes cataract. Which one causes retinal deposits? Retinal deposits. Ret is red. That is thioridazine. Okay, thioridazine is your RID or RIT, retinal deposits. Okay, retinal deposits. Which one causes corneal and lenticular deposits? Not the retinal, cornea and lenticular. Remember, cornea and lenticular, that is C and L, that is your chlorpromazine. Okay, that is chlorpromazine, which is cornea and the lens. Okay, cornea and the lens. All right. Which one causes metabolic syndrome? Metabolic syndrome is basically weight gain, insulin resistance. That is maximum with olanzapine. ZAP, again the weight increasing, and also clozapine. So these drugs are basically used when a patient has resistant schizophrenia. When it's not responding to other drugs, that is the time when we use these drugs. Okay, that is the time we use these drugs. Now let's have a look at this table here. So characteristic properties of antipsychotic drugs. Okay, antipsychotic drugs. Look at this one. Cardiotoxicity, we said thioridazine, right? QTZ, QT prolongation, torsades, retinal deposits. Which one is the one which causes most likely neuroleptic malignant syndrome? Very, very important. And tardive dyskinesia. Maximum D2 block is by haloperidol. Okay, remember haloperidol. Now, which is the one causes agranulocytosis, weight gain, wet pillow, seizures? Clozapine. Okay, that's your clozapine. Then you have olanzapine, which is important for improving the negative symptoms also. Risperidone is the one which has maximum increase in prolactin, okay, hyperprolactinemia. And aripiprazole is the one which is partial agonist of D2. Okay, this is what you need to remember here. Okay. Now going to lithium, bipolar wala. Lithium, what is the mechanism of action? Basically, it acts via IP3 DAG signaling. It suppresses the IP3 DAG signaling. Okay, that is how lithium acts. Remember, the mechanism of action is IP3 DAG. Then it's used in bipolar disorders and prevents the mood swings. Prophylaxis ke liye. Remember, it has renal elimination and the half-life is 20 hours. That is why we said that the time required for steady state plasma concentration will be 4 to 5 days. So monitoring is done 4 to 5 days after the first dose. It has a narrow therapeutic window. That means it needs monitoring. Clearance is decreased by thiazides and NSAIDs. Remember this important interaction. Thiazides and NSAIDs basically increase the toxicity of lithium. Thiazides and NSAIDs, very, very important. The side effects are tremors, hypothyroidism, very important. And pregnancy, it's a category D. It can cause Epstein's anomaly, right? It causes Epstein's anomaly. That's about lithium. Alternative disorders for bipolar, remember valproate is very important. We have lamotrigine as well. Okay? And lamotrigine, what is the side effect? Remember, laat and muh pe rash karne wala, that is your rash, is a very important side effect with lamotrigine. Valproic acid is hepatic dysfunction, right? The liver is affected. Next one, lithium. We have seen this already in our previous class. It can be given oral or IV. Bioavailability is good. 99% orally. IV may it needs a loading dose. Half-life is 1 day. So it is monitored after 5 days. Take a morning sample. Empty stomach is not necessary for lithium monitoring. The monitoring is done 12 hours after the last dose, not immediately. And you need to skip the dose. Okay? Now, this is very, very important. Antidepressants. The various classes of antidepressants is where a question can come, which is SNRI, which is NASA, which is selective NRI. All of these, let us quickly revise that. Okay. So I'm going a bit fast because I know that you have exam day after, so that we can revise all of this quickly. Just a minute so that I can see the live chat. All right. So in antidepressants, first have a look at the mechanism of action. Antidepressants basically function by increasing serotonin and increasing norepinephrine, because basically these are the neurotransmitters which decrease in depression. So we need to increase them, serotonin and norepinephrine. So what are the various mechanisms that we have? The various mechanisms that we have is basically, you can see there are MAO inhibitors. Why MAO inhibitors? Because they metabolize these neurotransmitters. So we use MAO inhibitors, right? Next, we have the drugs which act via inhibiting the reuptake of norepinephrine and 5-HT reuptake. So what are these drugs? NE, that is your any norepinephrine reuptake wale. We have desipramine, maprotilin, and we have your selective norepinephrine reuptake inhibitor, atomoxetin and reboxetin. Remember atomoxetin? I'll tell you how to remember that. Very, very important, mirtazapine. Remember, mirtazapine is like a mard, and mardwala is the one. Mard goes to NASA. To go to NASA, you need to be a real mard. Not everybody can go. So remember, it is NASA. This is a very frequently asked question. Mirtazapine maintains the mard, that is no sexual side effects or minimum sexual side effects are seen with mirtazapine. And mirtazapine acts on the alpha 2 receptor. Okay, very important. Remember, it inhibits the receptor, alpha 2 receptor blockade. Okay. So NASA is noradrenergic and specific serotonergic antidepressant. It acts on the alpha 2 receptor. Okay, very, very important. And then you have SSRI, which includes fluoxetine and many other drugs. Now, look at this one. SSRIs, we said, are the most important drugs in psychiatry. Everywhere they are used. Fluoxetine, citalopram, which is very commonly prescribed. They inhibit the reuptake of serotonin, used in depression, also used in OCD, bulimia, anxiety disorders, right? Anxiety disorders or premenstrual dysphoric disorder also. Okay, premenstrual dysphoric disorder as well. Now, they can cause serotonin syndrome because wherever the serotonin increases, they can cause serotonin syndrome, especially with the drugs like MAO inhibitors, TCAs, and meperidine. What do you see in serotonin syndrome? There is sweating, rigidity, hyperthermia, ANS features. All those features are seen in serotonin syndrome. Okay, rigidity, myoclonus is seen in serotonin syndrome along with hyperthermia. Now, most of them are cytochrome P450 inhibitors. And remember, citalopram is safer for interaction. So, commonly prescribed SSRI is citalopram. Okay, it's citalopram. TCAs are the ones, remember, which also have anticholinergic side effects. Very important to remember. It has a lot of anticholinergic side effects. So, muscarinic and alpha blockade, that causes the side effect. Right? If I ask you that there's a patient who has depression along with angle closure glaucoma, which antidepressant is contraindicated? Tricyclic antidepressant. Why? Because it is anticholinergic, so it causes mydriasis, which is avoided in angle closure glaucoma. Okay. Now, then you have, remember, TCA toxicity is a very important point. It can cause coma, convulsions, and even cardiotoxicity. There is broad QRS that we see. Okay, there is broad QRS that we see. Okay? And the important uses, it is also used in neuropathic pain and enuresis. You have imipramine and amitriptyline used in neuropathic pain and enuresis. Very, very important. Okay. What did we see for enuresis yesterday? What is the defense mechanism in enuresis? What is the defense mechanism in enuresis? Right. Going back, that is regression. Okay. Going back, that is regression. All right. So now let's have a look at the drugs in each class. Tricyclic antidepressants, the only adverse effect, the limitation is they have a lot of anticholinergic side effects also. Nortriptyline, amitriptyline, imipramine, clomipramine, these are tricyclic. SSRIs are the ones which are most commonly used. Remember, you will not see the effect of SSRI for 2 to 4 weeks. So we need to give for a long term. And fluoxetine, citalopram, all these are the drugs. Now, this is important. Which antidepressants are SNRI? Remember, NRI, travel in a deluxe van. और आप मिलने जा रहे हो NRI को, ठीक है? You are going to meet, that is मिलना, and you are going to meet NRI. You have a NRI friend, and who comes in a deluxe van. NRI comes in a deluxe van. Remember, duloxetine, venlafaxine, and Milna, that is milnacipran. These are SNRI. What is NDRI? D stands for dopamine. So, norepinephrine and dopamine reuptake inhibitor. Remember, that is bupropion. Very, very important, used in smoking cessation. Bupropion. When I say bupropion, remember PO nahi, PO and nahi. That is cigarette BD PO nahi. So bupropion is antidepressant, which is also used for smoking cessation. And remember, it is dopamine reuptake inhibitor also. So BU is like bi. It has two actions, norepinephrine and dopamine. Okay, norepinephrine and dopamine. Which are selective norepinephrine reuptake inhibitor. Remember, atomoxetine and reboxetine. XX tells you that it will not act on serotonin. It's only on norepinephrine. So remember atomoxetin and reboxetin. Now, which is NASA? Who goes to NASA? MER, that is mirtazapine. Melatonin agonist. Melatonin is your melatonin. Agonist is agonist. So agomelatin, right? Agomelatin is the melatonin agonist used in depression. Spari and Sari. What is Spari and what is Sari? Spari is serotonin, partial agonist and a reuptake inhibitor. Remember, this is a partial agonist. That is vilazodone, right? You have the drugs basically which act on 5-HT receptors. We are not talking about reuptake, right? You have this serotonin coming here. One is acting on the reuptake, then the drugs acting on the receptors. So the drugs which are DODO, that is vilazodone, trazodone, nifazodone, remember इनके पास है दोनों actions, that is reuptake वाला also and receptor वाला also. Out of that, vilazodone is the one. Remember, villa is basically villa loves the receptor. It's a partial agonist. Villa is like we love. Okay, villa is loves the receptor. Trazodone is antagonism, serotonin antagonism, not agonism. Trazodone का हमको बहुत important याद रखना है कि the side effect is priapism. Remember, trazodone is teda. Teda मतलब opposing something. That means it is antagonist and it also causes priapism. Teda causing priapism. Okay. And then you have serotonin reuptake enhancer. It's a reuptake enhancer. That is tianeptine. Okay, remember that is tianeptine. How do we remember that? Napkin is like napkin. So whenever there is anything which falls, like let's say the water spills, to take that, to increase the uptake, we use napkin, right? So remember tianeptine increases the uptake. Okay, tianeptine increases the uptake. So let's quickly revise these drugs of antidepressants. The classes of antidepressants are important. Okay. So what do we remember here? Which are the most commonly used for depression? It is SSRI. Why the TCAs are not used? Because they have anticholinergic side effects. TCA used in enuresis, imipramine, used in neuropathic pain, amitriptyline, right? They have other uses as well. Now, which is your SNRI? Which is NDRI? Which is a selective norepinephrine reuptake inhibitor? And then which is NASA? Which is Spari? And which is Sari? Right, which is Sari? And which is a reuptake enhancer? Okay, these are the terms that we need to know. SNRI is basically NRI coming in a deluxe van, that is duloxetine, venlafaxine and milnacipran. NDRI, dopamine wala, is bupropion. This is the one used in smoking cessation. Selective NRI is your atomoxetin, reboxetin, which has X in their spelling. NASA is a MERD, that is mirtazapine. It acts on your alpha-2 receptor, alpha-2 antagonist. Then we have Spari, which is serotonin partial agonist. This is vilazodone, right? DONE are the drugs which have both receptor action also and reuptake action also. Vila is the one which loves the receptor. Trazodone is the one which is theta and hates the receptor. It is antagonist. Serotonin reuptake enhancer is tianeptine. Okay, the napkin is used to increase the reuptake. Okay, that is tianeptine. So these are the drugs that we need to remember. Okay, these are the drugs that we need to remember. All right. Now, these are some quick review points on antidepressants. Identify each drug. Which is the one which inhibits norepinephrine and dopamine reuptake, used for smoking cessation. If there's a lot of toxicity, it can cause tachycardia, insomnia. Right, which one is this? Inhibits norepinephrine and dopamine. This is bupropion, right? This is bupropion. Alpha 2 antagonist. As soon as you see this, alpha 2 antagonist, that means it increases the release of norepinephrine and serotonin. Which drug is that? Alpha 2 antagonist is going to be which drug? Right, that is your mirtazapine. Okay, that is mirtazapine. Then you have the next one which is given, blocks the 5-HT receptors and also inhibits the 5-HT reuptake. So receptor को block कर रहा है और reuptake भी कर रहा है, that is trazodone. Okay, that is trazodone. So remember trazodone, it causes priapism. Very, very important. Okay, it is very, very important. All right. Next one, nicotinic acetylcholine receptor partial agonist, which is used for smoking cessation, is varenicline. Remember when I say varenicline, that is your nicotine. Okay, that's your nicotine. So it acts on nicotine, acetylcholine receptor. It's a partial agonist. So it gives effects like nicotine. So it's used in smoking cessation. Which is the other one? Inhibits 5-HT reuptake and it's a 5-HT1 a partial agonist. Partial agonist with reuptake is vilazodone. Okay, it is vilazodone. And then you have another drug to be added, vortioxetine. What is vortioxetine? Remember, it's like RTI, that is I. It has three actions. Inhibits the reuptake. It is receptor agonist and receptor antagonist also. It has all the three actions. That is vortioxetine. Okay, used for depression. Okay, it is used for depression. So that is about this antidepressants. Okay, that's about antidepressants. So now tell me about your drugs, which are basically for opioid toxicity and opioid withdrawal. Okay, what drugs are used? Long-acting oral opiate used for heroin detoxification. What is the answer to this? What drug are we talking about? Long-acting oral opiate used for heroin detoxification. No, this is not naltrexone, because remember, this is particularly asking for, and first of all, it is saying that it's an oral opiate. Naloxone, naltrexone are not your opioids, right? They are opioid antagonists. So that's why I read the question carefully. Yes, very good. It is, yes, correct, Aruna. It is methadone. Okay, it is methadone. So remember, methadone is an oral opiate, long-acting, used for heroin detoxification. Next one, which is used in a sublingual form to prevent the relapse for opioid, and it is a partial agonist. Now this one is it buspirone? Is it bupropion, buprenorphine, naloxone, naltrexone? This is partial agonist. Remember, it is buprenorphine. Norphine is like morphine. It belongs to your opioid. Bupre, imagine like mu and p, that is mupe, it is partial. Okay, mupe, it is partial agonist. Okay, so remember that is buprenorphine. It can be used in the sublingual form. Remember, bu is like bu, that is buccal. Buccal, like, remember, sublingual. Okay, it can be given in sublingual form. Short-acting opioid antagonist used IM, IV, or even as a nasal spray to treat the acute overdose, particularly to reverse the respiratory and CNS depression. That is naloxone. Naloxone is like nullifies the opioid. Okay, nullifies the opioid. So that is naloxone, which is short-acting, which is a long-acting oral opioid antagonist used after detoxification to prevent the relapse. That is, again, naltrexone. But remember, it is naltrexone, which is a long-acting. Okay, it is used for preventing the relapse. Acute toxicity, remember, for opioids, acute toxicity है, naloxone use करेंगे. Naloxone nullifies the opioid. And if it is to prevent the relapse, then it is naltrexone. Basically, to get back on track. Okay, to get back on track, we use naltrexone. Okay, that is what we need to remember. Right. So that was about the quick review for the today's psychopharmacology. We have quickly overlooked the antipsychotics, antidepressants, lithium, and Alzheimer's ke drugs, some psychotherapies, and also your opioid, right? The opioids. So, when are we gonna meet next? We are meeting again at 1 p.m., 5 p.m., and 9 p.m. today. We have 3 more classes. 1 p.m. is a free live class on the Unacademy app, where our focus would be on quick revision of biochemistry. Right, so the last minute, like important points in biochemistry, like amino acids, the various enzymes deficient in various disorders, all those, whatever is important, we'll try to discuss in that 1 hour. 5 p.m. is again the mnemonics course, which we're starting today for the Unacademy Plus subscribers. FMG students, this is specially for you. So please, start with these sessions. And the NEET PG students should also attend the today's class at 5 p.m. And 9 p.m. again, it's a free live class where we will be talking about exam hall tips. So myself, along with Dr. Zainab Vora, there would be an integrated session on Unacademy app. Okay, so yes, this is over. So as I said, because you have exam day after, so I'm going to go a bit fast and I'll not take much of your time because I know that your time is very, very precious now. So nothing except studies now in the last 2 days. So enzyme cofactors, we will quickly do a quick revision, Ravina, in the 1 p.m. class. Okay, the rate limiting enzymes, enzyme cofactors, amino acid disorders, right, and a lot of other things which are important in biochemistry, we'll try to revise in that 1 hour. Okay, thank you so much, everyone. Goodbye, take care, and keep studying, keep revising, and keep